Okay. For the internal and external rotate, which group you want to activate, internal or external? Internal, because the limb is always there, right? So how to do that in standing?
Like an associated reaction or this past stage, like
T-bands. T-bands.
The what?
Theraband.
Theraband? You mean in sitting and doing this movement? Okay, that's in sitting. Okay, but in standing.
No,
Okay.
I'm also saying standing, you can have
In
a
standing?
theraband across the body.
So?
Oh, never mind. That's adduction.
Okay, yes.
I'm an internal.
Mm.
maybe like a step up. Make sure their toes pointed forward and have them step up so that they're.
No, I want to activate, I want a movement.
You want open chain or closed chain?
This point is
Let's
gonna
do
be
close
close to.
Squats.
Hmm?
Squats.
Somebody said twister?
That's what I just said.
Okay, you said what?
Have your foot planted, make sure it's straight, and then, like I said, you're bringing your foot up, you're twisting over it so it's internally rotated in closed chain.
So you mean the body rotates or the leg rotates?
Your trunk rotates, or the pelvis rotates over the femur,
Okay, I want the leg.
the leg. So,
The leg.
So open chain or closed chain.
Open and chain.
Open chain.
Do you know the furniture sliders? Okay, so with the furniture slider, okay, you can do that. Alright, or you have the twister itself. So there's something like purple, you get, it's on Amazon. You can have the top half of it twisting, rotating. Okay, you put it underneath, okay, and you start rotating in and back, and in and back, rotating in and back. Okay, it rotates. Okay, so it's kind of a sliding like this. So it's very helpful. Okay, you know the balance board, the circle one. It has like a fulcrum, so you could put it underneath, but this would require a little bit of knee flexion, which you don't need, right? But you can have the patient standing on something on the other side, okay? And you start doing this movement again. Okay, make sense? Okay, so the twister, if you Amazon the twister, or the rocking board, round one, can rotate. Okay. This is what I have in mind for the internal rotators, but it works very good.
Would you only recommend standing, nothing in sitting, or
No, I said in sitting with the band.
with the band?
With the band.
Is it something similar to that test we do? Yeah, thank you. That test, where we have them stand and hold on to you, and they twist them like checking for resistance.
Would it be more functional?
Okay. I'm sorry?
Is there a more functional closed chain? To like, you know, if anyone's standing on a slider board all the time.
No, it's not a. I never use the sliding. If you're talking about the round rocking board, but I use the furniture slider because they are very thin. Okay, so the leg length would be not that high, or the twister itself. The twister is like this height. That's all. Okay, so it's kind of this rotation. Okay, but it's fine. You can do it. As long as you get the internal rotation, that's fine. What about the quads? Do we activate them? Hmm? Nah.
At the end.
Okay. Not for all patients. Some of them, they don't have good quads, especially the last 15 degrees. So we start with that inside lying position, same as with the knee. Okay, but this time instead of having them bend, okay, we ask them to straighten the leg. Okay? So many of our patients, they are losing those 15 degrees when they are standing because the calf muscles or whatever, okay, the weakness of the quads, they kind of like bend like that. Okay? To get the quads strong at these 5, then you do the short arc after that, and then you do the long arc extensors. Of course, having them stepping and going up, as we mentioned earlier, that would be the best because it's task specific. What about the calf muscles? Fully stretch? When you go back to the gait, they are active from the beginning to the end of the gait cycle. But you are kind of prioritize the muscles first. So if I have my patient early, I would work on the dorsiflexors first. When I have them very active, okay, I would then start switching and work on the calf muscles. Calf muscles, flexibility and strength, both are required. Okay, so when I started talking flexors, dorsiflexors, hip flexors, abductors, knee flexors, dorsiflexors. Then comes the plantar flexors and the quadriceps. The quadriceps before the plantar flexors. Okay? Quads are spastic, so they may support the patient in standing. Right? But calf muscles, they are active from the beginning to the end of the gait cycle. Need to work on that. Need to see the patient doing this movement, not doing this movement. At terminal stance of the gait, what we do, this leg, the calf muscle, would push us forward. Correct? That's the propulsion of the body. If you don't have this propulsion of the calf muscles, the patient would do this movement. So the calf has to be activated also. But remember, get the dorsiflexors first. If you got the dorsiflexors, okay, then you start. You can switch. You analyze the patient gait and see what is missing. You work on it. Too much, right?
No, let's practice.
Okay, let's have a practice. Or do you like break first? Break?